Hey there, welcome to another episode of eM-Dayspring. This is part 3 of our OB Module Reboot special. I'm Dr. Matt here coming to you from the weekend. Allison's off this weekend, so we're going to take a look at the OB module, and this particular episode is focusing on the provider visit. So let's go ahead and get started and take a look. There's a lot of very cool upgrades in OB module that we would like to look at. But there's just a few things that we need to be aware of going into this week, especially. Some of these items are going to be fixed before general release, but I want you to be aware of them as we go forward. The very cool thing is very little of our workflow has been changed, and a lot of this was designed after eMDs had taken a look at our workflow and found it to be very, very well designed. Going to start here with our tracking board, obviously. And the first thing you'll notice is normally this would say start visit, but I went ahead and started that just as a trial. One of the big issues right now is that when you open up a visit, it actually does not open up to the visit note. Unfortunately, it goes right to the reminders tab, and it does not go to an open visit note. So even if you click on visit AS, you'll see the visit. You can click on last visit, but it's non-editable note. And so you have to go to chart view. You have to select the visit with the little stork. I think one of the first things you'll notice with new OB module is there's no longer 2 visits for every 1 visit. In other words, here was yesterday's visit. It's a single stork visit and has a single visit associated with it. Here's today's visit. And what you'll notice is the visit is down here, and now instead of in a separate place, the flow sheet is actually stacked right above the visit. And you'll be able to see maybe 3, maybe 4 lines of the OB module flow sheet right above your visit, and so it's interactive and it's right there. To start your note now, right now we're going to hit Collect Edit, and we'll left click on that, and that'll open up the note, and this will generally be where you would start once we get this little bug worked out. The first thing you'll notice is that the flow sheet is right up here. The nurse and the lab have already filled out their portion. You can see a good portion of the flow sheet here, and items that are abnormal have been in red. Couple things that you can do. Note that the nurses will have started a chief complaint, of course, as is typical, and I'm just going to go ahead and drop yesterday's in here to get us started. And of course, our nursing staff also will have entered some of the basic questions, and this is about where providers would find themselves at this point. So the first thing you notice is you can actually enter the flow sheet in 2 different ways. Most of the time for the providers, you're going to click on the pencil here. Opens up a very nice window where it's very easy to go ahead and edit these fields. Now for this pregnancy, you'll notice that I have created one that's a twin pregnancy. And you'll see a BVA and a baby B. And so you'll be able to put vital signs on both of these. If it was a single pregnancy, then you'd only have a single column of information right there. Fetal heart rate would have been filled out by the nurse, but I'm going to enter it right in there. You can mark that the fetal movement is present and that there's no episodes of preterm labor. We're not going to do a cervical exam today, and she has maybe about trace edema on here. We can select next appointment now, or we can come back at the end of the visit and do that. I'm going to select 1 week since she's a high-risk pregnancy. Hit save. And now you'll notice that all that information is actually filled out here on the flow sheet. Information that's pertinent to the twin pregnancies are grouped right here, and so you'll be able to get that. And since she's only 5 weeks, we really don't have a fundal height, although if we say, I'd like to go ahead and add that in, I can go ahead and put that in centimeters here and say she's 6 centimeters, hit save, and come back, measuring on target at this point. Just out of curiosity, if you need to enter OB vitals, you can also get it through the Edit Vitals tab now, where it brings it up in the Complete Vital Sign module. And so if you need to enter additional information such as temperature, pulse, or other information, SAT, you can do it here, or you can, and then you can access the OB module information right here as well. It's the same information it carries over. We'll hit save and go on. From here, for the most part, the visit is exactly the same as it would be for ours. You open your visit, you confirm the data that the nurse had entered here, flipping down here real quickly and just agreeing with everything. You can add kick count information, which would be appropriate under the circumstances. If the patient says that they're, say, having a little bit of vaginal discharge and you want to document on that, you can click yes. And if you need to add it as a diagnosis, of course, you hit the little cogwheel. And if you just want to comment in it through a discharge template, you can just click on that and say that the presenting complaint is discharge only and that it's clear. And you can put a comment that normal, consistent with normal pregnancy discharge. And that allows you to make some extra documentation. If you click here, it takes you back to the original OB template. And if you're ready to get out, of course, then you can click on white area and it'll drop that information down in. For us, for review of systems, we go ahead and add the OB short, which is the one that just says negative for rash. You can also add the other one which says see template as well. Interestingly, I clicked on post dates up in here just out of curiosity, just as for a point of information. If at any point you guys would like to add a particular pregnancy symptom or pregnancy diagnosis and you can't think of how to search for it or find it, I have a lot of them listed in here under the reason for the visit. So sometimes if I'm even somewhere further down the visit and say, oh, I want to add post dates pregnancy so that I can access those templates, if you click on pregnancy diagnoses, you can select post date templates. The ones that are above this line right now have good active templates that you can use. So gestational diabetes, hypertension of any sort related to pregnancy, intrauterine growth restriction post dates, and substance exposure in pregnancy all have their own sets of templates that work very, very well as separate diagnoses besides what we do in the risk factor template. So if you want to add it, sometimes the easiest way is to come up here in the chief complaint template and add it this way. As it were, I'm going to discontinue that and just get rid of that diagnosis because it doesn't apply. For exam, again, we're going to select the OB routine check normalcy flow sheet because our data as far as things like edema and fundal height and whatnot are up here and we don't need to add that extra information. And then, of course, we're going to come down to plan and select, since she's a first trimester early pregnancy, I'm going to go ahead and select my mouse to get a pre-click. And our earliest one that we have is 8 to 11 weeks, and that will apply here. I go ahead and open it up just to check and make sure that my information is all correct. She's doing well. And at 8 to 11 weeks, basically we have our first trimester counseling, our first trimester precautions, and we're going to have her back in 4 weeks and appointment card. If we wanted to do a urine culture and sensitivity early on, we could do that if we chose to, but under the circumstances, we typically don't want to do that. So we're going to click off here and be done with that. We're going to go ahead and make sure that we set our appointment consistent with this, and so either going to change the appointment down here, or let's say this is pretty low risk, I'm going to put her back to 4 weeks here and hit save and go on from there. And as I scroll down, of course, any preventative counseling, I'll want to use our preventative care template for if it's appropriate, and just check and see, but her vaccines are up to date and everything's okay. She doesn't need her smoking status or weight counseling done, so I'm going to leave that as is for right now. And then finally, of course, you're going to want to come down to the ICD-10 section to charge capture this. She has been seen before, so note that her ICD-10 code is selected because it was linked to a previous visit with this patient. However, you do want to be careful about this because if you notice, this ICD-10 codes now are by trimester, and so once she hits past 13 weeks, you're going to want to move her to a second trimester diagnosis and then a third trimester diagnosis. And of course, it also depends if it's the normal first pregnancy or normal subsequent pregnancy, and so making sure you customize that. Unfortunately, because there's not a one-to-one link with the ICD-9 to ICD-10, we can't auto select them for you, but we can have this list available that you can check right down off it from here. And so again, we're going to select first trimester right there. And her preventative care, of course, is auto-linked, and so that one automatically has a code selected with it. You need to do nothing with that. And we'll hit save, and then we're going to go ahead and check out. So you select the checkout button. Again, a final confirmation that you've got the ICD-10 codes correctly. We've got our 99213, which is appropriate visit for this level of care. And we're going to hit accept. Now there's one thing that I do need you guys to look at on the note conclusion screen, and that is sometimes it doesn't open up all the way, and so you need to pull it down And just take a look down here at this prenatal record. This is often going to be pre-selected, which is very appropriate given the visit. However, right now there is a fix that needs to be applied that we're working on. So actually, in order to get the note to conclude without difficulty, you actually want to deselect that right now. And once it's deselected the first time, it should stay deselected. And if we want to print the prenatal record, we can. And if we do not want to, we don't have to at that point. But once it's deselected, we can hit conclude, and that will close the visit, and we should be in good shape there. Now, a few other things I want to show you guys about the OB module just to keep in mind once we're done printing there. So here we are again in OB module. The last visit displays the note that you're working on, or the note that was previous there. You click on OB module to come over here. One of the things you may notice is that the risk factors are smaller, and it's kind of a tight view, especially on our screens. This is a very large screen I'm working on, but on our smaller laptop screens, you're going to notice that it's a little harder to see, and there'll be a scroll bar. We're working on something to make that a little more prominent. However, for now, just be aware that you need to scroll over to take a look at all of those if you see the scroll bar there available. A lot of this is somewhat similar to the OB module, though it's a nicer look and a little bit sleeker. Note, if you want to see the entire flow sheet without having to scroll up and down, you can click on here. This patient's only had one, but normally all of the visit flow sheet details would be there. If you look under EDD calculation, you'll notice it's a bit simplified in the sense that we have the gestational age that the ultrasound was done at and the EDD based on that ultrasound. And so these two numbers are not going to change depending on what you select as the determining factor for the patient's due date. Only the EDD up here will change when you select that. And of course, just like other examples, you're going to get a warning that you want to make this change, and we're going to select no this time. One thing you guys might notice is that the cool thing about the OB module upgrade is that when the staff enters an ultrasound, it's actually going to put it in the correct trimester. And so if I say the ultrasound was done today, and let's say it was pretty much consistent with dates, she's 5 weeks and 6 days here, and we hit save, it's actually going to put it correctly in the first trimester, which is really cool. And the only thing to note is ultrasounds that were previously entered in the OB module that were migrated to new OB module may not be in the actual correct trimester. To fix that, we're writing a script that's going to go ahead and correct that. But in the meantime, if you want to see it in the right place, just simply selecting and then selecting off one of these squares, one of the fields will actually correct it on its own. So one last note is about the risk assessment. We're going to work on cleaning up the risk assessment a little bit, but please note that when you add a risk assessment now, there's no risk assessment that is specific to the individual patient. They are all there. And so one of the things that we're going to need to work on is making sure that we use broad categories for the risk assessment up here, and then make sure that we add the specific risk factors in our risk factor template, which I actually did not show you guys how to add, but we'll do that at a future visit. A future episode. Actually, we can do that real quick right now. We have a few more moments in this episode, so I'm going to kind of move down here. Remember that in addition to our pregnancy, we do have our OB risk factor assessment template, and that's important to use. We're going to say, let's see, that her age is greater than 35, and this not only documents the risk factors, but allows us to go ahead and make a plan. Like the patient decline genetics referral, or even allows us to do a high-risk referral if that's appropriate. And that, of course, is going to appear there. And then at each subsequent visit, we will go ahead and clock that forward as is appropriate. So I just wanted to let you know that that's still in play, and you definitely want to continue to use that one. So that's the episode on the OB module upgrades. We'll be going into some more specific details as we go forward. But I appreciate you guys listening as always. And if you have any questions, y'all let me know. Thank you guys very much.
I'm high on believing that you're in love with me. Lips as sweet as candy,